going to be doing a tonometry or intraocular pressure testing on Biscuit here. So what we're going to do is we're going to just start a timer as soon as I give these anesthetic drops that will numb the eyes, because it can be a little uncomfortable for them to actually have this test because we have to touch the cornea. So I've got proparacaine here. I'm just going to go ahead and lift the upper eyelid and just drop this right onto the conjunctiva. Just a couple drops and just allow her to blink. And I'll go ahead and do that. Same with this eye. Juan's just holding her here. She's just sitting comfortably, and we're just keeping her muzzle nice and steady. So right on the conjunctiva there. Dropping the eye drops right onto the cornea can be pretty uncomfortable for them, so we want to just try to make sure that they are as comfortable as possible. In the meantime, we've got our Tono pen here. It's already loaded with a clean little sleeve here. We're just going to go ahead and get it calibrated so the actual protective part of the sleeve hasn't been taken off, and I'll take that off as soon as I'm ready to do the measurements. Turning it on, just making sure to see if it works, make sure that it's calibrated properly, which it is. So as soon as my 30 seconds is up, 30 seconds to a minute to let those anesthetic drops kick in, I'll take off the little sealant here. It's calibrated. That beep says I'm good to go. I've just got my paper here just to log down the pressures that I'm taking. So what I'll do, Juan's just going to, again, hold her nice and steady, keep her muzzle nice and closed. I'll use my fingers just to kind of open the eye, and the anesthetic numbing agent should have taken effect. So I'm just going to go ahead and press the button, and I'll just press this right onto the cornea, just very gently. You're okay. Perfect. And I'm going to do this 3 to 4 times until I can just take an average, just reset it again, and do the same thing, just very gently. Is my reading again? And normal for dogs is about 15 to 25, and each reading so far has been normal. So again, 19 again. And we'll do one more just for safe measure, so pressing the black button, resetting it so that it's good to go. Opening that eyelid and just taking the tip of the pen right along the cornea until I get that beep that's good to go. Perfect. So I got 19, 20, 19, and 17. And so I'll just take that off. We like to just kind of prepare the pen so that it's good to go for the next person to use it. So I'll just open this up and load the new sleeve on there, keeping that protective cover and just putting it away so that it's good to go. And then I'm going to grab a calculator, and we'll actually average these. So we've got 19, 20, 18. So average was about, let's see, 19, is 18. So she's in a normal range for intraocular pressure. What this test is really important for is early detection of glaucoma. Glaucoma is a disease that is clinical of high intraocular pressures. Glaucoma can lead to blindness, to dogs having to have their eyes enucleated. So it's really important to be preventive about this if we're worried about it, to test these intraocular pressures, and just to make sure that they're staying in a normal range, because it can turn into an emergency in a matter of a day or less. We've seen dogs come in here with super high intraocular pressures and have to have their eye taken out because we weren't ahead of the game. So it's really important. Right now she's at the perfect range. We're not worried about glaucoma, but it's good to just test it if we have any clinical signs of the disease.